In the past few weeks, you may have noticed the same word coming up over and over again.
Unprecedented.
Unprecedented.
Completely unprecedented.
Unprecedented. It's not a bad word to use in reference to the COVID-19 pandemic. But this isn't the first health crisis to hit Evanston. The deadliest pandemic of the 20th century could tell us a lot about the one we're living through right now. Let's go back to the fall of 1918. World War I is raging on, and a disease that's been making its way around the world arrives in the Chicagoland area via the Great Lakes Naval Training Station, about a 40-minute drive from Evanston in 2020. The 1918 flu was an H1N1 strain of influenza. You might have heard that term a few years back, too.
The 2009 influenza pandemic.
So a number of news organizations going with H1N1 instead of the swine flu.
What we are seeing in 2009 is unprecedented.
The 1918 virus infected about a third of the world's population. Some estimates say the pandemic killed 20 million to 50 million people around the globe. A world war happening at the same time proved to be effective in spreading the disease. Some of the earliest cases of the 1918 flu in the US were identified in military personnel. By the time the flu hit the training station, the virus's first wave had ended, but a second, deadlier one was already underway. A week after sailors at Great Lakes fell ill, 7 Army cadets at Northwestern's Student Army Training Corps came down with the flu. Evanston Health Commissioner C.T. Room responded to the outbreak in a mid-September issue of the Evanston News Index, a now-retired city paper. Full disclosure, we couldn't find any footage, photos, or audio of Room, so we got an actor to play him.
Hi, my name is Daniel Nares, and I'll be reading for CT Room. It is possible and quite likely we have the disease here in a different form and called it by a different name. It is not a particularly dangerous disease, though there were 16 deaths in Boston. However, there were several hundred cases. The attack generally runs its course in about 4 days.
In the fall of 1918 is when the United States actually first started mandating reporting influenza outbreaks. Before then, you didn't have to report if you were having an influenza outbreak because it was seen as so particularly common. It's not surprising that it was sort of not seen as a big deal.
Just 2 days after the News Index published Room's statement, the flu posed an even greater threat to Evanston. An army camp in the city saw 6 suspicious cases develop and quarantined 2 barracks in response. Though none of these cases had been officially diagnosed as influenza, one sailor at Great Lakes came down to Evanston at around the same time, feeling sick with what turned out to be the flu. Just days later, the News Index reported that William Johnson became the first flu death from the Evanston community. His death came amid worsening influenza conditions in Evanston. Remember that army camp that had potentially 6 cases just a few days earlier? That number was now up to 42. And one physician believed there could be at least 200 total cases in Evanston. The following days saw more deaths, more funerals, and more illness.
In the past week, there have been 7 deaths from pneumonia, the majority of which have evidently been secondary to the so-called grip or influenza infection. There is no question, but what we have a serious proposition at the present time, and every reasonable measure should be taken to clear it up at the earliest possible moment.
To Room, those measures at that time meant isolating anyone who felt sick and keeping healthy people healthy. For the time being, though, he kept schools, movie theaters, churches, and Sunday schools open. All other public gatherings were still on, too. Amid all this, the state health department released a set of guidelines advising residents to avoid crowds, sick people, poor ventilation, and cold weather. Still, Evanston remained open.
But different cities handled it a bit differently on how sort of strict they were about people's movements. I mean, there were some towns that wouldn't allow anyone in. There was a variety of responses, if you will, to sort of how to slow it down, essentially, by having people do particular things.
Soon after Illinois released these guidelines, 2 representatives from the State Department of Health came to meet with Room and other city officials.
If in spite of our best efforts, the disease does assume greater proportions, it may seem best to close all schools and public gatherings. We sincerely hope, however, that such stringent measures will not be necessary.
That hope extended into the next day, when Evanston became the only city in the North Shore without a quarantine order, even as the number of cases in Evanston rose to 200, and the number of deaths remained at 18. The day after, Room said there were 145 new cases in Evanston, and with conditions failing to improve as the week went on, the health commissioner made it official. Evanston was in quarantine.
I hereby order closed all public and private schools except the Northwestern University and all churches and moving picture theaters. All other public gatherings are hereby prohibited until further order.
Other similarities between life during these two pandemics emerge as well. For one, healthcare systems were overtaxed. There were more patients than the Evanston hospital could serve. Pharmacists said they were working 16 to 17-hour days. And the News Index published calls for volunteer nurses day after day after day. Businesses weren't doing too hot either. A News Index column urged residents to limit their phone calls so operators wouldn't get overwhelmed. It paints a portrait of the, quote, difficult time for every large business organization. And amid the epidemic, the Women's Club of Evanston delivered food both to residents who were too sick to cook for themselves and those who couldn't afford to.
One woman said when food was brought to her by the club, "I don't know where it came from, but it must have been heaven."
That's according to KATHLEEN Moore, the superintendent of the Central Association of Evanston Charities. She also doesn't have any photos readily available, so here's another actor.
Many, many families who have never had to ask for help before have been forced into it now. I know of several families who have been independent until the influenza came. The breadwinners were prostrated and their source of income cut off.
One of the major differences between now and 1918 is now we actually have some social support system. So, there's unemployment insurance, for example, right? There's no unemployment insurance in 1918. So if you're not working, if your business is shuttered, there is not a sort of federal relief. Obviously we're seeing some of that sort of impact today, that some people do have to go to work in order to survive.
Religious services were also banned under the quarantine order. But 2 of the 3 churches Room visited one Sunday still held packed services, demonstrating some Evanston residents' reluctance to quarantine. Amid all this came more illness, more death, and more funerals. But cases were decreasing. On Friday, October 18th, Evanston had only 12 new cases. The following Monday, the city lifted its quarantine order.
Although we are raising the quarantine, that does not mean that we must cease for a minute our most careful efforts to prevent any further case developing or a return of this present epidemic of influenza.
With the state quarantine still in place, Room still urged residents to cancel all non-essential gatherings and take precautions against cold weather and dust. But for the most part, Evanstonians could get back to their lives out of quarantine. But turns out, Evanston and other cities made the same mistake we're trying to avoid. People crowded into theaters, sporting events, and other gathering places. Then, less than a month after Evanston's quarantine was lifted,
finally, on that unforgettable November the 11th, the Blessed Armistice,
fighting in World War I comes to an end, and people packed the streets to celebrate.
Paris, London, New York. Who could ever forget that surging, glorious day of celebration in New York City?
In Evanston, celebrations broke out upon reports that fighting had ended, and a November 11th speech from former President William Howard Taft at Northwestern's Patton Gymnasium turned into a peace celebration.
The streets were jammed from curb to curb by people utterly abandoned to joy. It was unbelievable, incredible, dazing and dazzling.
But jamming streets curb to curb with people isn't the best way to slow the spread of an ongoing pandemic. And throughout all of this, Room was warning Evanston residents about another possible flu outbreak.
The influenza epidemic is still with us. Take care of yourself. If you got tired out from the peace celebrations, rest up. If precautionary measures are not taken at this time, a new epidemic of influenza is liable to break out.
As the final month of 1918 began, influenza had found its way back to Evanston, with 275 new cases reported on December 2nd. Again, Evanston was slow to quarantine, even as neighboring communities were gripped by similar outbreaks. The same day Evanston saw its spike in cases, Chicago saw 22 deaths. Room justified the decision by saying these cases weren't as serious as the ones in the fall. And for a few days, Evanston did see a decrease in cases. Then, a slight increase was enough to push the city to announce a quarantine order. Again.
Are the people of Evanston willing to forgo the pleasure of Christmas gatherings, both religious and secular, in order that lives may be spared and sickness prevented? From the sentiments of all to whom I have talked, I believe they are not only willing, but demand the quarantine.
In the coming weeks, cases continued to fall until the city lifted the quarantine order on December 30th. The next day, New Year's Eve, Evanston rang out 1918 with what the news index called unusual enthusiasm. Room said the city could expect some cases for a while due to its proximity to Chicago. But for the most part, Evanston remained relatively unscathed as the pandemic marched into the next year.
There's a historian named Charles Rosenberg who writes about epidemics having 3 phases, a beginning, a middle, and an end. We don't know where we are, right, in that play. We're probably not in Act 3, but are we still in Act 1 or are we in Act 2? Obviously, there's lots of hypotheses about what normal is going to look like again, but it probably won't look like what it did in January.